Lisa Jones, the CEO at Health First and an obstetrician gynecologist. Finding out you're pregnant is an exciting time. You might immediately want to tell friends and family or rush to the doctor to confirm that you are in fact pregnant. But did you know that over the next 9 months you'll be seeing your provider regularly for prenatal care? Prenatal care is an important part of ensuring that you have a healthy infant. At these appointments, your obstetrician will check to make sure you're healthy by checking your blood pressure, checking your weight, maybe checking a urine sample, but they'll also be doing testing to make sure the baby is healthy. Early in pregnancy, that means an ultrasound. Later in pregnancy, that means measuring your belly and listening to the baby's heartbeat. All of these things are designed to make sure that you have as smooth as possible of a pregnancy and a happy outcome. As a part of prenatal care, we frequently do blood work. That blood work looks for infections that we want to treat. It also checks for diseases like diabetes. And later in pregnancy, checks to make sure that you're not anemic, that you have enough blood in your system to feed both yourself and your infant. We also recommend vaccines during pregnancy. We want women who are pregnant to get flu shots and a vaccine for pertussis. These are both incredibly important parts of prenatal care because a newborn infant can't fight off infections on their own. By getting the flu shot and the pertussis shot, you're actually protecting your infant after birth for about 2 to 4 months. So it's important to get those vaccines when you're pregnant. Finally, you'll have some physical exams during pregnancy. You might have a pelvic exam early in pregnancy to help figure out when your due date is, and you'll certainly have a pelvic exam later in pregnancy to see how close you are to delivery. Prenatal care is also an opportunity for you to ask your questions. You may wonder if a symptom is normal. You should ask. You may wonder what to expect during labor and delivery. You should ask. You might have questions about birth control after delivery. You might be interested in a tubal ligation for permanent birth control. All of these things are valuable to talk to your prenatal provider about. We build time into our appointments just to answer your questions. So keep a list, bring it with you, and make sure they get answered. That's probably the most important part of prenatal care, making sure that you feel prepared for delivery and for becoming a new parent.